Oh yeah.
Matters family. This is Janice Allen Jackson welcoming you to this episode of the Local Matters podcast of Georgia. While we are the Local Matters podcast of Georgia, we have an episode today that is of relevance throughout this country as we discuss the topic of public health. As always, this show is brought to you as a service of my consulting firm, and that is Janice Allen Jackson and Associates, where we provide services to local government and nonprofit organizations. To learn more about me or the services provided through the firm, please go to our website, which is janiceallenjackson.weebly.com, which of course is right there behind me. Also, if this is your first time listening to an episode here, please subscribe to us on YouTube so that you can get notifications when we post great content. Local Matters family, today we are joined by a guest who is all the way from Maryland in the Washington, D.C. metro area, to be more specific. How are you doing today, Dr. Spinner?
I am fabulous. Thank you for having me.
Thank you for wanting to come on. Family, this is Dr. Jovonni Spinner. She is a public health expert, she's an author, and she's a speaker. And she is going to be with us today to address the ever important topic of health, particularly as it pertains to the African American community, because we know sometimes we take it for granted that once you reach a certain age, you'll have high blood pressure and diabetes and dementia and amputations and all those things that follow those things. So we want to talk about how our current public health systems address those sorts of things and what we can do as individuals to ensure that we are in better health. Before we get started, we're going to ask Dr. Spinner to tell us a little bit about herself. I could introduce her, but I know she'll do a much more thorough job.
Awesome. Well, welcome everyone, and thank you for joining us. So I am Dr. Jovonni Spinner. I am the CEO and founder of Beacon Public Health, and we're a full-service public health consultancy firm that focuses on diminishing the impact of chronic diseases among Black, Indigenous, and people of color. So as you mentioned earlier in your welcoming remarks, we want to talk about some of these myths around every Black person is going to get diabetes and there's nothing we can do to avoid getting a chronic disease. So we're going to break some of that stuff down today and talk about what we can actually do to live healthier lives so we can all thrive and do the things that we enjoy. And so with Beacon Public Health, we focus a lot of our work around building culturally competent and equity-centered public health programs. So what that means is that we are designing health education programs for consumers to be able to make informed decisions about their health. For example, we also focus in on professional development. So making sure that the public health and healthcare workforce that are serving our communities are equipped to better understand what are our motivators, what are our barriers to seeking care, and so they can better be able to provide care for us. And then also just bringing awareness and attention through our advocacy efforts and speaking engagements and interacting with people like you so we can spread the word around what it really takes to be healthy and to stay healthy. And then lastly, we do research around pressing public health issues that we need more answers on and to provide more insights to inform all of the work that we are doing. So I've been in public health for a long time. It is my passion, and I am one of those fortunate people who, gets to work in their passion. So it doesn't feel like work because this is where I want to be. This is what drives and motivates me. And the way that I got started in public health. So like a lot of young Black kids in America, growing up in a Black household, your parents give you some career options. And as you can imagine, being a doctor or a lawyer with top of the list, right? And for a while, I wanted to be a dentist, and that was kind of my career path until I got into college as an undergrad and I was a biology major. And then by the time I graduated, I was burnt out, didn't want to do it anymore, and really need to do some self-reflection and soul searching to figure out, okay, so what am I going to do? I have this degree, but what's my next steps? And long story short, I ended up finding public health through taking some graduate courses at my university, Virginia Commonwealth University. And then what it did for me was like a light bulb moment. It really highlighted the fact that where my passion really lied was in public health. So while I did not want to be a practitioner and only focus on individual level care, I really wanted to look at those systems level issues. So what is preventing us from being able to make the healthy choice, right? So looking at those social determinants of health, like our housing, our transportation, income, education, all those non-medical factors that influence our health outcomes, which most of the time are out of a person's control. So that's where I really want to focus my efforts. And then looking at those health inequities that have caused health disparities in our communities. So after, figuring that part out, I went back to school, got my master's degree, and eventually my doctorate degree in public health. And I have been working in public health ever since. I spent a lot of my early career working at state and federal government, which was absolutely rewarding before branching out onto my own and starting my own consultancy firm. So that's a little bit about my education background and kind of how I got into public health. But really, for me, it was really also about just taking a look around my community and seeing what the struggles were, right? You see people having to make decisions about, okay, I have to get my prescriptions this month. I have to put food on the table. I got to pay the light bill, et cetera. But I have a finite income. So what am I going to do about all of this? And these are decisions that nobody should have to make. Like, you shouldn't have to choose between healthcare and basic essentials of life, right? And so that's why I really wanted to focus my efforts on how do we address some of those systemic issues. So that's a little bit about my why and my purpose about wanting to be in public health. And most recently, to kind of really reflect on my public health journey, I did co-author a book with some other phenomenal ladies in public health. And the title of the book is Public Health Entrepreneurship, Navigating the Intersection of Purpose and Profit. And so really my motivator for being a part of the book project was really to highlight to other young folk who are considering a entrepreneurship path in public health, and really to provide some insights on what does this really mean? How do I, continue to earn a living so I can support myself by also pursuing my passion? What does public health look like outside of the corporate walls, outside of the government, outside of nonprofit, et cetera? And so in the book, you'll learn a little bit more about my journey, like the type of work that I'm doing. And, you'll hear about the stressors of being an entrepreneur, because while entrepreneurship can be glorified at times, there are other times where, it can be very challenging. And so this provides a real world depiction. I saw you raise your hand, like, it's great when things are flowing and you're getting contracts and your clients are, being supportive and doing what they need to do. But then on the other days where, the contracts aren't flowing, the clients aren't being as cooperative, or, you're trying to scale up an initiative or a project and you're, run into a whole bunch of, bumps in the road, then what? So that's what I talk about in the book as well. So.
You summarized and hit on a lot of things that we're going to expound upon as we go through this conversation. In your consultancy, if you could just talk in a little bit more detail about, who your client base is, what types of services that you provide, I think that will help our audience focus on and get a better understanding of who you are.
Absolutely. So this is another kind of Black girl magic moment for me. So I've been so fortunate that some of the clients that I work with now are some of the same organizations early in my career I desired to work for. Like, I was putting in those applications like, oh, I got to work at this organization. They're doing great work. I need to be a part of it. And now I am a part of it, but in a different capacity. So primarily, I work with nonprofits most of the time, but I do work with government, for-profit businesses as well, academia, etc. But in the nonprofit space, for example, one of my recent clients is the National Association of City and County Health Officials. You may know them as NACHO. If you're in the health department space. And actually, one of the projects I just finished up for them, actually, I finished it up last year, but it just launched last week. So this is a very timely conversation. Is their Roots of Health and Equity course. So this is an online asynchronous course for public health professionals or anyone who's interested in health equity, right? And so my company, we were able to redesign one of the modules on public health history. And so we take you through the journey over the last few hundred years around the impact of public health, what have been some of the tensions, what are some best practices, lessons learned. We develop different case studies around different topics that disproportionately impact different communities as well. So it is a wonderful course. It just launched last week. It is free of charge. You can either take it as an individual or you could take it as a group because there's a lot of reflection in the course. There are a lot of discussion prompts. So it is really nice when you are able to interact with others who are taking the course at the same time. So if anyone's interested, they can go to NACHO's website and type in Roots of Health and Equity, and then you'll be able to see the course from there. So that's an example of one of the projects that I've worked on last year. At the end of last year, I worked with the Association of Black Cardiologists, and I led an obesity roundtable for them. So this brought together experts across multiple sectors to talk about what are the effective strategies for the treatment of obesity. I think we all know that obesity rates in America are skyrocketing. It's epidemic proportions, and Black people are disproportionately impacted by overweight and obesity. So that was another opportunity to be able to, build community within those different sectors, to bring them all together to talk about what are policy options, what are research options, what are community-based strategies that can be implemented to help treat obesity better, particularly for minority communities. So those are two examples of some of the clients that I've worked with. Another one is Feeding America. We just hosted a health equity training for them for a cohort of local food banks who are a part of this health equity cohort. So my team, we did a full day training around health equity principles and how do you take those principles and infuse it into your work so you can provide better services for your neighbors within your community that are being serviced by the food bank. So that was a very, very good training, highly engaged, a lot of breakout work, and again, some reflection to allow people time to really strategize and think about how do I apply this information? Because the one thing we want to make sure that we are doing is when we are interacting with others, particularly in a training space, we want to make sure that the information is shared. We're moving from theory to practice and that they can see themselves in the solution and be able to take some information home and say, okay, now I can do this better because I learned about it yesterday in the training, and this is going to, better support the community that I'm serving. So that's a little examples of some of the work that we've done.
And how long have you been in your own business?
That's a good question. So we officially started in March of 2020 was like the official start date. But
You started with the pandemic.
yes, officially. But before then, I had already been strategizing and doing some, freelance consultancy projects and, really thinking about my own business plan and what would my goals be and my mission, et cetera. But the one thing that I learned through that process is we are our own worst critic and we need to rip the Band-Aid off and just start. So I'm in my office ruminating for well over a year about, oh, what's the name? What's the mission? All this other type of stuff. And it got to the point where it's like, you know what? You're never going to get better and grow if you don't start. So I was like, you know what? Let me get my EIN number. Let me go ahead and get my website together because all the ideas were there. The skills are there. And one thing I have to remind myself of is if my previous jobs were willing to pay me for this work. There is no reason why I cannot do it for myself and do it well. So, just kind of like, getting out of your own way and just starting. And then once I started, it like flourished beyond belief. So I'm really impressed and excited about like the opportunities, like I said, the different clients that I'm working with and the relationships that I'm building, because that's really the foundation of the work is the relationships.
You know what, as you were talking about this whole discussion you have with yourself, what am I going to call the business and what the mission is and da da da. You know, you put something in place, you can always change it later if you don't like it, particularly related to the mission statement and the services provided. Because I know as I got deeper and deeper into my entrepreneurial journey, would say, nah, that service probably not going to work out for me right now. Let me emphasize XYZ instead of ABC. It's a constantly evolving process, and you just have to change with the environment to make sure that you're providing what potential clients needed at any given time. So yeah, I'm completely with you there. I have a friend, completely separate business from either one of us. Your public health, local government, and nonprofit services, but I have a friend who's looking at doing more public relations types of things. And she sat there forever trying to figure out what it's going to be. It's like, finally, just send the paperwork into the state, get a name for the company. You'll be okay.
So here's a funny story for you. So this will tell you how over prepared and over, how much I'm an overthinker. So, as I was strategizing about the companies, I had put together this presentation, right? It was different names and, missions and everything. And I called in my family and friends and we had a little meeting in my living room and I presented all these ideas to them. And by the end of the presentation, they looked at me and said, "That's not it. You got to start over." They were like, "What does this mean?" They was like, "You can do better." So, but it was very helpful because it forced me to like really think about, the meaning of the company and stuff like that. So, but it just goes to show how sometimes you could just be over prepared and overthink things. And like you were saying, you just gotta put it out there and you can always refine it and change it later.
Yeah.
And as a smart business person, you will have to learn how to be resilient. You will have to learn how to be able to pivot to, like you said, to address your clients' needs. If you become so stagnant and staunch in your approach, you're not going to have the ability to grow at all. You're going to be stuck right where you are if you have a fixed mindset of, oh, it can only be done this way. Well, I decided I was only doing professional development. But if you got 20 clients coming at you saying, I want health education campaigns, and that's your skill set and a desire of yours, then there's no reason why you shouldn't pivot in that direction.
Just go ahead and do it. Just go
Mhm.
ahead and do it. That is really interesting, but and not uncommon. As you were saying earlier about people think, oh yeah, you're all here running your own business, all of it's so wonderful. And sometimes it is, but sometimes it's like,
Yeah.
it really causes you to explore who you are and what your strong suits are. So it seems like both of us have sort of been on that journey as well. Hit upon something related to health as you were talking, and you talked about obesity. And the first thing, two things crossed my mind. One was there's some physicians who now subscribe to the theory that almost every health problem is an obesity problem. There's a weight management issue in there somewhere. And the next thing that crossed my mind was Ozempic. So please feel free to respond to both of those thoughts.
So I do believe that we have a weight problem in America, right? Obesity is an issue. It does lead to a whole host of other conditions. It makes other conditions worse as well. But I also do believe that you can be healthy at any size. So for me, I take a very much a holistic approach to health. So for one, I don't subscribe to the BMI. I know that that is a tool that is used to be able to, put you on the scale of, where you are in obesity. But if you think about it, if you are an athlete, let's say Serena Williams, who is, no one would ever say she was fat, but I could probably guarantee you because of her muscular structure, she probably has a higher BMI. But Another measure of health will be actually your waist ratio and your waist to hip ratio. That's probably a better indicator, because the more fat you carry around your midsection puts you at a higher increase for chronic diseases, because your midsection is where all your organs are. So if you have a lot of fat around your organs, then that's putting you at a higher risk for developing a chronic disease. So I think that is very much just as important as just looking at the number on the scale. And I also think sometimes we get so hyper focused on the number of the scale that we lose sight of what it means to be healthy. Our meals being focused on whole and healthy foods, right? We can still maintain our culture and still be healthy. Mainstream America would tell you, oh, well, soul food, is unhealthy or whatever, but we could still have that, but maybe have it in a different way, right? Or maybe have it in moderation. So I don't think it's an either or. I don't think you have to give up who you are in order to be healthy. Yes, will you need to make some changes? Yes. Will you need to modify some things? Absolutely. But I think if we think about our health from more of that holistic lens, then we'll have a better opportunity to be able to actually reach our health goals, right? So I think we need to focus on that. As it relates to Ozempic, in my opinion, obesity is it is a medical issue, and that is a treatment for obesity. So I would encourage anyone to work with their medical provider to see if it is the right choice for them. I don't particularly care for it being more of a cosmetic drug, for people who already, seem to be already thin or whatever, want to lose that last 5 pounds. I don't think that's the right use of it, but there is a medical indication for the use of Ozempic and other medications like it, but under physician care. And that's a decision that needs to be made between the patient and their physician, which is also another important area that we need to touch on, is the relationship between the patient and the provider, and really focusing on patients as a whole patient and looking at all of the factors that go into a patient being able to make a decision about their health. We're not algorithms, we're not, oh, because you're here, you weigh this, you must do this. But look at everything else that's going on. What do I have access to? Do I have access to, the fruits and vegetables and proteins, et cetera, that you're asking me to do? Do I have access to, either green space or gym or whatever to be able to do any type of physical activity? So we got to think about it from the whole person, and not just algorithm. If you do this, then do that, then do that, but thinking about it. And these medications don't have to be a long-term solution, right? They could be used short-term to help you get to your goals as well under physician care.
Awesome. I appreciate those comments. I remember when that whole notion of BMI came about. I don't know, it's probably 30 years or more now. But I remember somebody saying, look at somebody like Karl Malone, who was playing in the NBA at that time, very muscular person. According to the BMI, he was overweight. But if you look at him, you'd never guess he was overweight. He just looked strong, you know? So I also remember a conversation with a former director of recreation and parks when I was in Albany, Georgia. He was dealing with a weight chart. I think that was before the whole BMI thing became big. But he said, according to those charts, I'm supposed to weigh 180. And I think about it now, my skeleton weighs 160. I don't know. Get that. 180. But there are, that's the fallacies. I think some of us feel real bad if we're not consistent with those weight charts or now the BMI charts. And I don't think it was intended to make anybody feel insecure or feel bad about themselves. But I think sometimes that's the net effect.
It definitely can be. And you can definitely get caught up into it. And particularly for women, as we age and our hormones start to change, as women go through perimenopause and then menopause, that's a different type of weight. That's a different type of weight to try to get off, right? So you think about also pregnancy and childbirth, how that can impact your body as well. So there are just so many other factors. So instead of getting so caught up on this one number that can actually fluctuate a huge amount even within one day, right? For me, it's just an added level of stress. Not to say that it's not important to like obviously monitor and manage your weight, but having this fixated view of I have to weigh this instead of focusing in on, is my body strong? Is my body healthy? Is it functioning the way that it should be? For me, that is the bigger, more important picture that we need to be thinking about.
Okay, great. I was really enthralled by your conversation earlier as you were talking about the services that you provide to businesses, the converse or nonprofit organizations or government organizations. The idea of helping practitioners communicate appropriately with patients of color. I think that's very significant. I'd like for you to talk about that a little bit. And I also, though, as you discuss that, like to hear you talk about the responsibility of us as patients in learning how to communicate with our healthcare providers. And I'm going to give an example as you think through that. I've read an article somewhere, can't tell you when or where now, but it was talking about how sometimes if we don't feel comfortable with the practitioner, we're not going to be open and honest with the practitioner. And one of the things that I started doing when my kids were very young, man, I would go into the physician's office with them, but I would let them do the talking as a way to encourage them to be confident in those communications, as a way to encourage them to really think about what's important to say to your practitioner. And of course, I would be there to back them up, if there was something I thought that they missed or something that they needed to emphasize. But I wanted them to learn how to do that because that is a skill in and of itself. So if you can talk some just about how practitioners communicate with people of color and how we in turn are obligated to communicate thoroughly with them, some of the things that you can teach folks that you're dealing with.
Sure, sir. So first off, I really appreciate the fact that you were helping to train up your children to be able to be advocates for themselves and learn how to interact with the healthcare system because it can be scary for a lot of people because particularly in the Black community, we put so much power and emphasis on two people in our community, our pastors and ministers, and our doctors and healthcare providers. So when that white coat comes in the room, a lot of people stiffen up because they're like, okay, this is a person of power and authority, and whatever comes out of their mouth must be the truth. It must be the law. And I shouldn't, ask any questions or look like I'm questioning their authority when in fact, the exact opposite is true. We should be showing up with question. We should be in that room to better understand our care. If they say something to you and you have no idea what they're talking about, then you pause them and say, hey, could you repeat that? Could you explain that differently? Or hold on, how do you spell that medication that you're suggesting for me? Or, asking the questions around what's the impact going to be on me? What are possible side effects? Or, I'm not sure if I'm going to be able to do this because of these reasons. So then alternatives can be proposed to you. Because one thing that's really important is, how our information is documented in our medical charts, right? So what you see the doctor on their computer, typing up, that's a part of your medical history. And so we don't want to be classified as, non-compliant, et cetera, because that may impact the type of care that we could get later on if we have to go out to see a specialist or even need more advanced care. So it's really important from the provider side that they are taking this information into consideration. And again, when I was talking earlier about having that whole picture and being able to really understand, well, what are all the mitigating factors that this person has to consider in order to do the thing that I am asking them to do? It may seem like an easy thing, right? But a lot of times it's a lot more challenging than that. If we even look at obesity, I mean, the formula is simple: calories in versus calories out. But all of the factors that influence the calories that we take in and all of the factors that influence the calories on how we burn them and get them off, that's a very complicated formula. That's not a one size fits all approach. So we got to move past just the eat better, do more physical activity. But in terms of like the communication piece, I definitely encourage patients to do their research. And when you're doing your research, make sure that you're going to websites that are credible. A lot of people are getting their health information off social media, Instagram, Facebook, TikTok, etc. But make sure you research who's giving you that information. Like, do they have the appropriate credentials? Are they, credible enough to be talking about this issue? For example, find out more about them. Where did they go to school? Where did they get their certifications, et cetera, to make sure that you're not getting misinformation that could end up being more harmful to you. Make sure that you go to multiple sources and validate that information. So if you heard something off TikTok, maybe go online and say, oh, well, let me see what maybe the CDC, Centers for Disease Control and Prevention, might have to say about the same topic. WebMD or blackdoctor.org or other sites that have credible information, to make sure that the information you are ingesting is appropriate. And then when you show up to your doctor's office, feel free to take that information. I go in my doctor's office all the time with something new. I'm like, hey, I read this research study and I want to know what does that mean? And they're like, where do you get this from? And I'm like, I can share the article with you. But it also goes to show, research shows that patients who ask questions get better care, because now you're opening up dialogue, right? And the physician knows that you're serious about your health. You're in there, you're taking notes, and feel free to bring someone else with you to your appointment. If you think you're going to be nervous or not able to fully understand or comprehend something, take a family member or a friend with you that you trust to help, take notes for you, or maybe to ask some questions where you may have, missed some gaps or things like that. Because all of that's very important when we are communicating. And the other thing from the provider side is providers need to be trained on how to be culturally competent. Right? We need to be trained on effective communication practices and adjusting your communication for different patients, because what may be seen as offensive in one community may be appreciated in another community. So you have to adjust yourself for whoever you're talking about. That's not even just a provider-patient relationship. That's any relationship, to be honest, but particularly for providers. So having that cultural humility when you are interacting with patients is so important, because our culture is the core of who we are. It influences our worldviews. It influences how we make decisions about our health. It influences how we interact with the healthcare system, when we decide to interact with the healthcare system. So we cannot negate our culture when we're talking about healthcare. They have to be considered hand in hand.
Thank you for that. I'm glad that you let people know that those things aren't off limits. It's not a bad idea to bring somebody with you. It's not a bad idea to make your list of questions in advance. It's not a bad idea to do your research from some other source. And speaking of research, reading reviews of physicians, if you're going to a new physician for the first time, is that something that you would recommend?
Absolutely. And this is one thing we don't really do that well in the Black community, is talk about our healthcare experiences. So we should be talking to our friends. Hey, which doctor do you go to? Do you recommend them? What's good about them? What don't you like about them? Having a referral for me is like the best way to go, because if you've done right by my family and my friends, then you're likely to do right by me, instead of just picking someone arbitrarily. I know there are a lot of limitations between insurances and who's in your network and out of your network, but I think that's an important conversation to have, is to also talk about our healthcare experiences, so we kind of know what to expect. So when you were talking about taking your child to the doctor earlier, and starting to get them to talk up for themselves and things like that. So now they have a better idea when they come alone what to expect. And I think we need to do the same thing in our peer-to-peer relationships as well. And so we can have those open and honest conversations about the level and quality of care we should be expecting and receiving from our providers. And also the other thing is, don't be afraid to use your portal. You know, a lot of practices now have opportunities for you to, you know, go into the portal, put in comments and messages to your provider. That's another way. If you forgot something in your visit, go in there and ask the question.
Right.
And that way it's also documented. And when they give you the response back, you also have the opportunity to digest it at a little slower pace, because most medical visits are rushed, or they feel rushed because they're on a time constraint because of, you know, insurance, et cetera. But that's a whole nother conversation. So, you know, don't be afraid to use your resources so you can get the best care as possible. And there's no need to suffer in silence, right? If you feel like something isn't right with your body, then that is reason enough for you to go to a physician. And if you're not getting the care or concern that you need from that one, then you may have to go to another one. And that's totally fine. You know, even if that physician you've been going to for years, decades, you know, all of a sudden doesn't feel like they're giving you the right care, you are free to switch to another provider. You are free to get a second opinion, and you should get a second opinion because you are the expert on your body. You know what's different for you. You know what's regular for you. And if something is off, then you have to advocate for that and to get answers that are suitable for you, and that you feel like you've gotten the best care and a resolution to your issue.
Thank you so much for that. I recently had to go to a new practitioner, somebody I hadn't seen before. So I was sitting there waiting in the waiting room. I was like, let me check out who this dude is. You know, what kind of reviews does he have? And after reading the review, this was somebody had been referred to by another provider. After reading the review, I started sitting there thinking, I might have to get a little aggressive with him. Because some of the comments were that he kind of blew past their issues. You know, they didn't think that he was necessarily taking them seriously when they came in with different complaints. And I made a decision of what my demeanor would be based upon the review. And as it, you know, turned out, I think everything was okay because it was a minor issue that I had to begin with. It was more like something where I just wanted to make sure that this was not anything major. And the interaction was okay, but I had just kind of made up my mind as to how I needed to approach this before the visit itself started. So thanks for that. Next question, public health, just a discipline of public health departments provided by state and local governments. Pandemics and such are what they were set up to deal with. So they get into chronic health management, some as well. Are there things that you wish public health departments would do more of to better address the needs of people of color?
Yeah, so health departments are definitely, you know, safety net providers in many of our communities. So, and I know during COVID, they were, you know, taxed and stressed as other parts of the healthcare system were as well. But I think in terms of like what can be done differently or maybe better is the community engagement piece. I know there are a lot of people who don't even know their health departments even exist or what they do. They think, oh, you only go there if you need like STD testing or immunizations, but health departments are, you know, full service medical providers, right? So I think having some better community engagement and collaborating with, you know, community leader organizations to really understand what are the specific needs of my community that I'm serving? What are some gaps that we could, you know, fill and provide better services for? And really starting to build up those collaborations and partnership. So then you also have champions of your work. And so there is like kind of like cross fertilization there where the community members now know what the health department is doing. They know that they have a vested interest in their health and their well-being, and vice versa. The health department knows, well, you know, particularly in the case of COVID, like who should be reaching out to promote vaccinations, right? Who should be the face of this, right? To make sure that we're getting our community vaccinated and protected against COVID. So that community engagement and partnership piece, I think, is really important as well. I know it's kind of hard, especially for some health departments who may be understaffed and under-resourced, but really making sure that, any type of health education and promotion is culturally tailored, and translated into multiple languages, right? Because we want to make sure the materials that are put out there for community members, they can see themselves in the materials, right? That you took effort to make sure that it was culturally relevant, particularly for languages. If you have like a Spanish speaking population, if you keep giving them English, materials and they don't understand it, then what's the use of the material? It's useless. So anytime a person can't understand the health education that's been given to them, is useless. I mean, most Americans read at like a fifth grade level. So we got to move past, the technical jargon. And I know it's a fine line between maintaining the scientific accuracy, but it also has to be in plain language that people can understand and be able to make an actual decision on that information. So I think health departments definitely could play a role in making sure that, health education materials are culturally tailored and also translated into multiple languages. I think there's another opportunity maybe around the advocacy piece to, advocate for those policy changes that are needed to address some of those systemic issues and those inequities in the healthcare system. And I know everything I'm saying is asking a lot of a health department that's already doing a lot, but just thinking about, if there are some initiatives, which is why the collaboration and the partnership piece is so important, because you don't have to do all the work on your own. Maybe you're facilitating the work or spearheading it, leading the initiative, but you have a team of, champions and invested people to help you, realize the mission of whatever you're, trying to do. So I would say if we could focus on that, and then also around improving data collection and analysis, particularly as it relates to collecting demographic data. So then we can have a clearer picture of who's getting impacted by what, right? If you don't have the data, then, you have to use data to make informed decisions, to help drive policy change, to help drive resource allocation, to help drive program development, right? So having that, equitable data collection practices, making sure the data is representative of the community. So those are a few things that I think health departments can play an active role in. And I know there are a lot of health departments who are actually doing some of this work. But again, it all boils down to resources as well. A small health department in a small town is clearly not going to be able to accomplish, the same magnitude of work as a well-resourced, maybe big city health department, for example. But I think there are areas that any health department can start to infuse into their work. And it's not to say you got to take on everything at once. You obviously got to prioritize. But that goes back to the knowing your community and knowing what's going to be most important and valuable for them.
Awesome. We have had a wonderful conversation today. I appreciate you so much. I think those of you who listen to Local Matters on a regular basis know that sometimes I just put out a call and say, hey, who's interested in being a guest and how can we address issues? And this is someone who I got an email in my box a month or more ago and said, hey, this person's interested in being on Local Matters. And I read her bio and I said, yeah, perfect guest. So I was not wrong. Thank you so much for reaching out to me with the desire to be on the Local Matters podcast. Once you come on, you're part of the family. So welcome to our Local Matters family. Before we prepare to close out, is there anything else that you would like to share with our listeners?
I would just say, as a reminder to always put yourself first, and your health is your wealth. So being mindful of, what you put in your body, how you treat your body, and prioritizing yourself, because as the old saying goes, you can't pour from an empty cup. So I think you made a comment earlier, we're not destined to end up with a chronic disease and all the complications that come along with it. Yes, genetics do play a role, but we can take an active role in either trying to avoid a chronic disease or trying to lessen the complications of a chronic disease through our health and our lifestyle.
So I used to think that it was just inevitable, but there are people who are in their 90s who think, well, in fact, I met one a few days ago. I was working on a strategic planning project with a client. I was out at it was a health fair. Ironically, we were just there generally to gather information, but it was a community health fair. And there's a woman who walked by my booth and she was 91 years of age. And she talked some about her background and her upbringing. I mean, grew up in a sharecropping family, as you might imagine. And then she told me some about her children. And I said, hey, do you still drive? And she said, my children won't let me drive, but I could if they would let me. And I thought it was just remarkable. She didn't have a cane. She didn't have a walker. She wasn't in a wheelchair. She was just walking from booth to booth at a health fair on a summer afternoon, and she was 91.
Wow. That's amazing. I'm
So,
gonna be like that when I get 91.
yeah, me too. My goal is to live to be 106. But and on top of that, she had her own teeth. I mean, it was just really remarkable. So it goes to show that yes, if you prioritize yourself and you take care of yourself, that yeah, we can live long and healthy lives. I will say that no, she was not overweight. She was on the rather trim side, but all of that worked for her.
Awesome. Well, I think that is a good testament and something that we can all strive for.
Yes, yes, yes. Thank you so much, Dr. Spinner. If people want to learn more about you and your work, please let us know where we can go to do that.
Absolutely. So they can visit my website at beaconpublichealth.com and you can learn more about the type of services that we offer. And we also have some educational resources as well. So we have different campaigns and we have different articles and things for people to, get more information about different health topics as well. And of course, if you are interested in buying the book, you can get a copy off of my website at beaconpublichealth.com. And for any of your listeners, they can get 20% off if they use the code podcast 2024.
Thank you so much again for introducing yourself to me and also introducing your work to our audience. We wish you the best. Bye bye.
Thank you. Bye-bye.
You enjoyed this episode. If you did, please leave something in the comments. And also, I'd like to let you know that as you check out my website to learn more about me, I am available for speaking engagements at conferences, workshops, and keynote addresses as well. So please reach out to me via our Contact Us page on the website. Thanks so much for joining us today.